Hi, I'm Dr. Wightman here at Holtorf Medical Group. Today I wanted to do a short video on erectile dysfunction. It's a very common problem, pretty easy to diagnose. Most men with it are well aware of it. It involves about 3 million cases a year. It's simply that the patient is unable to get an erection or maintain an erection when desired, especially for sexual intercourse. There's many causes of it, many issues. It's psychological or physical. The physical issues often related to prediabetes or atherosclerosis and small vessel disease where there's inadequate blood flow into the penis. There's also psychological factors involved, of course. For the person that has it, it can be very stressful. It can affect the relationships. Of course, it can affect self-confidence. There's many treatments. It's almost always treatable. Sometimes tests are necessary, but not always. The various treatments, there are some supplements that can help. We have a product called Nomax. It's L-arginine. It's been quite successful to increase flow. Things like beet extract that improves nitric oxide flow and blood flow can be helpful. Things like ginseng, arginine, like I mentioned, and some of the other testosterone boosters. Testosterone is more about libido, though, rather than erectile dysfunction. So that's useful to check, and that's often an issue. Things like acupuncture can be helpful. Kegel exercises can be a bit of help. It's also important to have good exercise, avoiding excess weight, avoiding hypertension, avoiding high cholesterol levels. There's various drugs that are out that most people know about. There's 4 main ones. Viagra and Cialis are the 2 main ones. There's also Stendra and Levitra. The 2 more common ones are Cialis and Viagra. They have different actions and different side effects and mechanisms of working. So let's review that. Viagra, that's been around the longest, takes about an hour to work, lasts 4 to 6 hours. It actually is more powerful, but it also has more side effects. The typical side effects of Viagra are headache, flushed faces, blue light sensation of the eyes. I had a guy yesterday who said, "Give me that, I want that," but not really. And nasal congestion. It's very affected by a big fatty meal, and as I say, it takes about an hour to work, so you've got to pre-plan a bit. Cialis works within 15 minutes, lasts a good 24, maybe even 36 hours, has less side effects versus the Viagra. Some like one versus the other. Cialis is just a little more mild. It's not quite as powerful. Some guys actually like a little cocktail of a little bit of each one to kind of improve the benefits of both with less side effects. Other treatments include direct injections into the penis. I have some patients that do that, but that's a little uncomfortable and not for everyone. My newest favorite treatment, because the drugs that I just mentioned, they're what's called phosphodiesterase 5 inhibitors. And I told you about how they worked. And that works on the vascular system to improve blood flow. The new thing that we've got, we're doing a lot of work in peptides. The peptide that's actually amazing is called PT141. PT is a peptide that works on the nervous system, so it's very different. So it can work when the drugs don't. And it's pretty amazing that you can get an erection of a 21-year-old. It is incredibly powerful and safe. It does have a few side effects. We need to teach you the dosing on it. It's a little injection, not into the penis, anywhere subcutaneously, typically into the abdominal, subcutaneous to the abdominal wall or the thigh. You want to start with a low dose. It can have some side effects, especially if you use too much. Side effects of nausea, runny nose, headache kind of things. But it is pretty amazing. It might take 3 hours to work, so you have to pre-plan. But the other very important point is that it's also very helpful for females. It might take a little longer to work, but it definitely increases sensitivity. And I know of females that have been very happy with that treatment as well. So you can ask me about that as well. We have a special on, as a matter of fact, right now. There's a new therapy I can teach you about called shockwave. I know how to do it. I can teach you about that. That's kind of a new, unique way. It's very expensive though. So if you're a patient of mine, I'm glad to talk to you about it. You can ask me about it. If you're a patient of one of the other doctors here, of course ask them about it. I know they know about these things. If you're not a patient and are interested in follow-up, I'd be glad to do a mini visit, about 15 minutes, see if you need any lab tests, kind of go over some of the options and some of the therapies. So that's pretty much a summary of erectile dysfunction. If you have any questions, call our office. I'd be glad to talk to you about it, or we'll go from there. Thank you very much. Call in if you have any questions. Thank you.